how important is that first feed then, where they do that little crawl and they try and get up onto there? How important is that first feed?
Yeah, it's really, really important for so many reasons. So ideally, we want your baby, as soon as it's been born, to be brought up onto your chest and remain there for a good few hours with warm blankets over the top, so they can just be skin to skin with you, and you can get that first attachment going within the first hour. That's the most important thing. That it's called the golden hour for quite a few reasons, because research has shown that women who have had a breastfeed within that first hour have a much more significant milk supply at 6 weeks. So it does something to, it's stimulating that message, like, right, we've had a baby, our placenta has been detached, now let's go. We need to get things going.
Wow,
We're
okay.
feeding. So yeah, skin to skin, and then the beautiful baby breast crawl. So if you're not sure of it, you can honestly Google it, and you can see so many beautiful videos of it happening, because it's hard to believe until you see it. So yeah, babies have so many instincts to be able to find the breast and feed on their own. So if you sort of recline back at birth and allow the baby that time, they will gradually work their way down to the breast.
That's so amazing how it
awesome.
happens.
Mm-hmm.
Yeah, I watched a video of it prior to mine. And it's hard to try and get that experience yourself as well when you're in after having the baby, because people want to get in your zone.
They do.
Get your hands off. I want to watch this crawl.
Yeah. Oh, baby crawl. That's a good point. Some of them actually won't. You will need to help them on there, and that's fine. Yeah, but it is so good for their instincts and reflexes to get going to do that feed. And yeah, definitely within that hour. And another really important thing to consider is where you give birth. Okay, because, you know, a lot of places will take the baby, regardless if it's medically warranted or not. A lot of them will just quickly rub the baby, you know, do a quick check and bring the baby back to you. Okay.
Yeah, okay, so you don't want them to be leaving you.
No, unless it's, you know, warranted and necessary, then that's different. But if we can leave that mother and baby undisturbed, that's such an important time. And not only that, a lot of research is now coming out about the baby's microbiome and how that exposure to their mother on their chest is like their first introduction to that, and it's influencing their microbiome from their mother. So it's really important to not disturb that if we can.
So is there any way of a woman knowing if their place is going to be an intervention type 1, or is it just asking questions?
Asking questions. I would talk to your midwife or your obstetrician wherever you're birthing, and discussing what their practices are around that. And also keep in mind that certain medications can affect breastfeeding as well from the birth, even epidurals.
Yeah.
Yeah. So a lot of, most anaesthetists will say, no, that doesn't affect it, but it actually does. And it does affect the baby. So we need to keep that in mind as well.
That's an important one. So getting the correct latch is obviously very important, and not having the right latch is a cause of pain. How do we know, can you describe what the right latch is, and how should it feel?
Yeah, it's probably the most important aspect, getting the right attachment and position at the breast. I really need to make up like a song or a jingle or something so women will remember it. That'll be my next.
We want to hear this in the next time we talk.
I will have it prepared. So getting the right latch takes time. It takes a lot of time because you've never breastfed before. Yes, breastfeeding is natural, but it's a very much learnt skill. So it's about being patient with your baby, being patient with yourself, because it is a timely thing to get right. But what you want to make sure we're doing is putting your baby right up against your chest. So there's no gap between you and your baby. The most sustainable hold is called the Cradle Hold, and that's what we always try and facilitate women to do from the get-go. So I'll try and describe it. So essentially it's the same arm as same breast that's going around the baby's back, and you really want the heel of your palm just to be supporting a baby's shoulder blades, and a nice flat firm hand along their back. So we want their chin to be extended into the breast, so that you're in that drinking position, because they cannot swallow. You can't swallow like this. So look at where their chin is in relation to the breast. So there has to be an extension. If their nose is like diving into the breast, you know that they're not going to be able to facilitate a nice open wide mouth. So you really want that position, that stability there through your hand is all they need against your body. And then your spare hand, okay, that can come around and essentially, especially if women have flat nipples, which I know we're going to talk about, you can sort of shape the breast a little bit to exaggerate that hold, because it's called breastfeeding, it's not nipple feeding. And quite often that's the most common issue, is the baby's just got a really shallow latch. It's not actually getting onto that nice deep areola and breast tissue. So we really want to sort of tilt the breast tissue back, because you're actually going to be offering the underside of the breast where the areola is. And then sort of aiming your nipple toward the baby's top lip or nose even. And if you can tickle their nose and their top lip, they actually will open up their mouth nice and wide. And then once they've done that, you can really help them on to facilitate a nice deep attachment. You'll know it's right if it's not painful. It can be quite, overwhelming at first, because you're like, Jesus, they've got a strong vacuum, they've got a strong suck. And most women will say that. They'll be like, wow, is this normal? It's very strong. So as long as it's not painful or pinchy, then you know you've got it right. If you start feeding and you think, oh gosh, that's actually feeling a bit sore, don't persist with it, because you're going to end up with nipple trauma. So what you can do is pop one of your fingers in the corner of the baby's mouth, break the suction and take them off the breast and try again. Okay? Because that's the number one thing. Probably the most common breastfeeding adjustment I make to women is their babies are too far over onto the breast. They need to be more central, like bring them across so their chin goes into that extension. Yeah, and it's only a little micro adjustment, but it makes a world of difference. And often most women will say to me, I feel so much better. Yeah, very simple, but...
That's a really good visual that I hadn't thought of. When we drink water, we tilt our heads back, and you can't really do it when your head's tilted forward. You can't physically swallow when your chin is down, so they have to be in that position. And trying to remember to break the seal and reattach if it's not feeling right. I also remember thinking, oh, he's on. Because, you didn't want to get on, and I'll be like, oh, I'll just persist because he's on.
That's exactly right. That's what a lot of women do. He's on and he's happy, and I'll just continue.
Yeah, then you have a nice big sore, and you're like, toe curling. Mm-hmm. So let's go into the flat nipple while we're on that point. Flat nipples can sometimes make it more challenging. Firstly, is it always going to be a challenge for someone with a flat nipple to feed?
Not necessarily. It's honestly about the mother and the baby dyad. So there's a really beautiful expression I love, and there's no such thing as a baby. There is a mother and a baby. So it's about the two and how they work together. So it's about the baby's anatomy and abilities, and it's about the woman's anatomy, and everyone's different. So doesn't necessarily mean if you've got flat nipples you're going to have issues, but it certainly can increase the likelihood that you will. So it's about having some good sort of ideas going into it. What can help you facilitate a nice attachment regardless. Some women even have inverted nipples, So there are lots of different things you can consider if you do have some flat nipples. Obviously seek early support from a IBCLC, and you can do some sort of shaping of the breast, even with your hands or with a breast pump for a few minutes before you attach your baby, to try and avert the nipple a little bit before putting your baby to the breast, and that often can be a little bit beneficial. You might need to, like I said, with that hold, you're like exaggerating the shape of the breast. So it's called the scissor hold, where you get two fingers either side of the areola and really exaggerate that shape, sort of like it's a hamburger. That's what you want to imagine. Really focusing on that and really exaggerating that shape can be a really good thing. And also there are those beautiful nipple shields that can be really helpful, but we don't introduce them until your milk is in.
Okay. So it can take how long, like 5 to...
It varies from woman to woman. Okay. Usually on average like 3 to 4 days postpartum.
I found nipple shields so frustrating myself, but I've heard lots of people that found them to be very good. I just couldn't get it to bloody stay on.
Yeah, there's a trick. Did you invert it before putting it on?
Yeah, I tried all the tricks and just couldn't.
Yes.
But we had lots of things going on.
It's also about your anatomy as well and your breast shape. Sometimes, depending on the shape of your breasts and where the nipples are situated, can make them impossible to stay on. But yeah.
Well, you sort of think once the baby's been feeding for a little while, a flat nipple will never be a flat nipple again. So they kind of always eventually kind of pull it out.
They do. Especially after a period of time, I see women they come back and say, look at these. He's done a great job of bringing them out. So yeah, it certainly can improve over time. But like I said, everyone's different. So.
And then the second time round, if you were to do it again, can the nipples go back and then you have the same problems again, or would the journey hopefully be better the next time?
Oh, that's a tricky one because, they're all different. But I suppose the second time around, you're a little bit more familiar on what works for you.
Yeah, okay.
But again, every baby is so different. As long as you seek that early support is probably my best suggestion.
Yeah. And is there anything that can affect a good latch? So you sort of said the thing about the nipple shields with the supply, but something like is dummies, bottles, is anything else that can kind of impact a good attachment?
Yeah, look, we try and hold off on introducing bottles and teats and things like that if we can, and gummies. But, look, I feel like we put too much pressure on women because they're so fearful that if they do, it's all going to go pear-shaped. But in the right situation, it's absolutely okay. I don't like women feeling too pressured to do that. But yes, so we try and say hold off on introducing any additional supplements if you can, like formula, unless it's medically warranted or indicated. Medications and things like that, certain medications you're taking or that the baby might have been exposed to in pregnancy or in labour and birth. They can be quite sleepy. Jaundice babies, because they're quite sleepy and they don't often do the best job at the breast. Something I tell all new mums to be mindful of is that even a term baby born is often really sleepy for the first couple of weeks and they're not the best feeders. Okay. So it's really important to identify when they have fallen asleep, when they're not doing that nutritive sucking and swallowing and they're just having a boob nap. Mm-hmm. And really, it's another thing to do. But we do want to be encouraging them to feed effectively and efficiently while they're there, for them and for your breast milk supply. Because the way that breast milk supply works is by frequent and effective removal of the milk. So if your baby's only taking a little bit and a little bit and a little bit, it's not really going to be stimulating your breast as they need. Okay, so not sending those signals to make the milk that you need for your baby.
So you've kind of touched on it a little bit there with improving supply. Some women don't get a great supply and sometimes they have to have medication to improve their supply. You said earlier on that the supply might be affected if they weren't put straight on during the golden hour, demand supply kind of issues. What are other reasons why their supply might not be great?
Lots and lots of reasons, but there are two different types. So is it a perceived low milk supply or is it an actual low milk supply? Because a lot of women will come to us saying, I've got a low milk supply, I need to do this. But actually, when you look at that, they've got an amazing supply. So we need to sort of just, understand what the situation is first. But for some women, it can be related to their anatomy. They might have insufficient glandular tissue. They may have had previous breast surgeries that can affect their milk supply, such as augmentation and breast reductions and things like that. Mm. It might be the fact that they've had a significant postpartum hemorrhage, which can have an implication on your breast milk supply, and certain physical conditions as well that can affect their milk supply, especially if women are following a routine as opposed to following their baby. That can also reduce their breast milk supply. So it's really important to feed your baby on demand and observing their feeding cues. Minimum feeding for a newborn is around 8 to 12 feeds in a 24-hour period, day and night. Your breasts don't switch off at night, unfortunately, and that's actually a really important time to feed your baby for your breast milk supply. Your prolactin level is highest at night, which is the hormone responsible for producing the milk. So hence why it is important to stimulate breast day and night.
It's a tough gig, ladies, but
It really
you've got to
is.
do it.
Unfortunately, I wish I could say, "Nah, sleep all night, you'll be fine." There are other reasons, such as one, it's called the top-up trap.
Okay.
You might have heard of it.
No.
So some women start topping up their babies because they think that their baby has, or you have a low milk supply and your baby's
So
not
top up
enough
with formula.
with formula, and that in itself is just a vicious cycle, and it will just lower and lower your supply over and over again. There are medications that you can take to help increase milk supply. I'm sure you're aware of them, being a pharmacist. But you definitely need to seek IBC or CIT support before that decision is made to see if it's warranted. You can't just go popping a pill because you think it might be helpful. So definitely seek support early if you feel like you may have some supply issues.
Yeah, so those apps that try to put baby on a schedule,
On a timer.
on a feeding schedule, sleep schedule, they can...
They're really dangerous.
yeah, it sounds like it.
They are. And there's so many books out there, popular books circulating that suggest women feed exactly a number of minutes. So 13 minutes on the right, 12 minutes on the left. It actually doesn't make any sense. Every woman's breast milk storage capacity is different. One woman could store 150 mils per breast, another 60 mils. So that baby wouldn't need to be fed as frequently, and that baby wouldn't, need more frequent feeds. So if there's any of those books that you're coming across or any of that information, you need to just push that to the side and really follow your baby's leads.
So can you feed a baby too much on the boob?
No.
Just pop them on there.
No. Put them on.
Yeah. What was that saying that you said
If in
before?
doubt, whip it out. That's not my saying, but I do like to say it. The Milk Meg, she's another lactation consultant. She uses that phrase often, and I love it.
It's good if you're not sure if your baby's upset or crying, always try and offer the boob. It's often can just settle things.
Yeah.
So I remember this is a question I had when I was feeding. I was getting a bit of a sore on one of my nipples, and so I found it really uncomfortable, obviously, and painful to feed on that side, and I was always quite reluctant. Can you just feed off of one boob while you're giving the other one a bit of a rest?
Absolutely, and you can do that to both breasts if they are damaged. So if any woman has damaged or sore nipples and, putting the baby to your breast makes your toes curl and you just want to cry at the thought of it, then you really need to rest and express those nipples, because that's not really normal, okay? And you really need to seek good support and see, why is this happening? It shouldn't be happening. So what can we do to help this? So the first step is, it's called resting and expressing, and using an electric breast pump, ideally, a double if you've got one, and expressing your breast milk as you would the times that your baby would feed. And you can do that obviously by breastfeeding on the breast that's comfortable and expressing on the other breast. But some women, it depends on what stage you're at in your breastfeeding journey as well. Some babies will only feed from one side per feed as they start to get older. But in the early stages, you really do need to be stimulating both breasts.
Okay.
For your supply. Yeah.
So, as they're getting older, they might get enough of a big feed off of one,
That's
and
right.
they just not really want to be on the other one.
That's right. They might go on for like a second and be like, yeah, I'm done.
And so do you always need to offer both, or do you just go with how you're feeling?
Yeah, so in the early stages, you absolutely need to offer both breasts per feed until your milk supply is established and your feeding essentially is established, your baby's gaining weight and things like that. So I'll tell you what a newborn baby does. Okay. Because it's very different to an older baby, which you have.
Yes. Oh, that is so varied now. Yeah.
So a newborn baby, like I said, they're very sleepy, and even more so if they're in earlier gestation, even 38 weeks, 37 weeks, they're what's called a late preterm baby. And we often find that these babies do tend to struggle for the first couple of weeks. So they might need additional support, and you might need a bit more support there just for those couple of weeks. But in saying that, yes, a term baby will get onto the breast. They'll have maybe 5 or so minutes of that nice nutritive suck swallow, and then they'll start to slowly fall asleep. And it's really important to monitor that, because often we're on our phones, we're too busy, we're not really paying attention to what our babies are doing at the breast. So paying attention, slowing down, minimising visitors, especially within the, that beautiful first few weeks. Recognizing once they've slowed down and doing some really beautiful breast compressions to help that milk flow happening. And quite often the baby will pick up and respond and do, more nutritive sucking and swallowing. And once they've sort of done that again and fallen asleep again, then you can break the suction gently, sit them up on your lap, wake them up a little bit. And maybe that's a good time to change the nappy. Depending on how the breast is feeling, you might need to put them back onto that breast. So if it's still quite full, or uncomfortable, put the baby back onto that breast and until that's relatively softened and comfortable. Then you're going to sit them up on your lap again, burp them, put them back to the other breast. Now, not all babies will burp, but it's essentially just a technique to wake them up before offering the other side. So there's a beautiful lactation consultant I work with who uses the phrase, you've got to offer them appetizer, entree, main, dessert. So it was a way of remembering that we often need to just keep offering the breast a couple of times per feed, make them active in their feed, make them efficient in the time that they are at the breast. Because you've got to remember that when a baby is against your breast and on your body, that is home to them. That is their favourite place to be in the world. So if you allowed them to be, they would be there all day. But what we need to be mindful of is that they're actually feeding effectively when they're there.
Yes, especially if you're like, my little man again was a very lazy feeder, I suppose, like you just said in those early days, always wanting to fall asleep and trying to wake up. So some good techniques, like you said then, were to pop them up and even do a nappy change. Yeah. Is there any other little techniques you can do to keep them awake during the feed?
I actually do a little elbow pop. So once they're nice and asleep, you just pop your hand under their elbow, lift it up a little bit and pop it down, and that might wake up a little bit as well. Yeah.
Okay, like a little startle.
A little startle, yeah, keep it going.
Let's go now just into mastitis, because I think sort of where we're heading is potentially some things to prevent mastitis. Mastitis obviously is infection and inflammation in the breast tissue, and it's commonly caused from ducts being not emptied correctly. Is that right? Would you explain that?
Yeah, that's right. So it's an inflammation in the breast tissue because resulting from insufficient milk removal and, blocked milk ducts. So first and foremost, we need to make sure that your baby is attaching and feeding well at the breast. If that's happening, if you notice that, often you notice a tinge of redness on the breast first. You need to get that looked at straight away if that sort of appears. And you may then develop symptoms like you would a cold or, a flu. You feel a bit run down. You might just start to develop a temperature, shaky, a bit weak. You need to be seen ASAP, within those few hours, because it can come on so quickly.
Okay, so if you notice a little bit of a warm spot, it could sort of develop even within that day.
Yeah, absolutely.
Is there anything you can do straight away when you notice a hot spot?
Yeah, so applying a cold pack from the fridge, not from the freezer, is really important. Too many women put heat on their breasts and it's actually cold, because cold is going to reduce that level of inflammation in the breast tissue and allow the milk to flow more freely through the ducts. Okay, that rather than a heat, we're going to be introducing more blood flow to the area. So always cold. You can take some Nurofen anti-inflammatories to help reduce that inflammation process. But ultimately, it's about effectively removing the milk and effectively draining them properly. So depending on what's going on with your baby, you may or may not need to introduce some expressing. With some nice gentle massage and stroking and things like that around that area down towards the nipple to drain it properly. But yeah, like I said, you really need to be seen that day.
Yeah, because it's also hard to know if it's like glands or like if it's a blocked duct or, if you're engorged, or there's so many things going on in there, and everyone's anatomy is different. You're like, what is this?
I know. It's really hard. And that's why I say to women, you need to become familiar with your breasts in pregnancy. Quite often women will start breastfeeding because you're then touching and feeling your breasts all day, every day, that they don't know what's new and what's normal for them and their anatomy. Some are quite dense, their breasts, some can feel quite noduly. So really, it should start in pregnancy. It should actually start any time. As a woman, you need to be doing regular breast exams. But yeah, ideally for you in your breastfeeding journey, you're going to benefit from knowing what's normal for you as a baseline. Yeah. But in terms of preventing, it's about that, again, the frequent and effective removal of the milk at those regular intervals. So some women may wake up one morning if their baby's, slept 6 or 7 hours, and they might go, oh my gosh, what's happened to my breast?
Especially if they've normally been up feeding every hour or two, and then they do a long stint for some reason.
And some women are more prone to mastitis than others. So if you've had mastitis previously, unfortunately, you're more likely to get it the second time around. It's really unfortunate. And some women are really sensitive to any firm pressure on their breasts. So even some of the nursing bras can be too restrictive for you. Always go loosey-goosey with bras. Like, the softer the better for nursing.
Okay, so no underwire.
Oh, God. No underwire, but
so uncomfortable.
Even just some of the regular nursing bras you buy, they are just too tight across the outer aspect of the breast. So some women can be really sensitive to that. Yeah, ideally, making sure your breasts are really well drained, slow down and rest, because another risk factor for mastitis is stress. So if you are becoming a little bit too overwhelmed, maybe you're doing too much, you're feeling quite run down, that's a way of your body sort of telling you, hey, you need to slow down a little bit.
Yeah. Wow, that is definitely a bit of a trick for mums to know how to rest and relax. And that's often the case. So we put our own health second.
We do.
Don't we? Or third. It depends on how many children you've got.
That's right. That's right. And always remember to alternate which breast you offer first.
Okay.
Yeah.
Of course, so one doesn't get too engorged.
That's right. Yep.
Well, you have just provided so much valuable information, and all of this stuff obviously are common feeding things that can happen more in the early days, newborny sort of stage. We'll have to get you on again to tell about all the other bits later.
Too much.
There is so much to remember, and I think, like you said, just be kind to yourself, mums, because it's a lot. There's a lot to get through, and I think we all do experience a bit of anxiety and stress and having a pressure to be a certain way or be nailing it. I don't think any mums nail it.
No, some just make it look like they are more better than others. But that's exactly right. Western culture does not support new mothers. We just don't. Like in so many ways. So, baby showers where we provide all these presents to the baby. And what happens when you visit a new mum? Typically you'll bring her flowers or a new baby wrap or something like that. What's that all about? We need to be supporting the mother.
Bring some food.
Bring a home-cooked meal. Do a load of washing while you're there and see yourself out. So if you happen to see the mum and baby, that's just an added bonus. But yeah, we don't really have enough sort of understanding and acknowledgement of what women and what mums and families need. And, and all this, you get back to your post-birth, your pre-baby body, all this pressure and bullshit. Like,
I don't think you can ever get back to a pre-baby body, and who would want to? Because our bodies have just done the most amazing bloody thing ever. It's a new body. You're a new person. You've stepped into motherhood.
So society's expecting us to look like we haven't got children or we haven't just given birth, like it's a bad thing. So a lot of unrealistic expectations are out there on mums, and it is hard, especially if you don't have that support network around you. But also knowing what it is you need. Quite often, if you have the support, but you don't know exactly what you need because it's also new to you. So I think it should start in pregnancy. Everything should start in pregnancy. You shouldn't be thinking about breastfeeding once your baby is here. You need to have that preparation beforehand.
Yeah.
Really, especially the conversation with your partner about how you're going to support each other to help this and to help you to make it work. How are we going to make this transition period into parenting a smooth one for us? You're recovering from childbirth, huge, let alone looking after a new baby, trying to nourish them the best you can, and running on very minimal sleep in the meantime. So how are you going to make this all work?
Yeah, we have so much time and energy and focus that we put into getting the birth. That's right. Getting this ideal birth, which having knowledge is power, and that's amazing, and having some idea of what you want so that you feel empowered with your birth. But, births will do what births will do.
That's right.
But yeah, probably having a bit more preparation about what you just said, what you're going to do in those early days and how you're going to get through. Where can people get support around that stuff and around breastfeeding questions? So we're going to hear where they can find you, but before that, like, is there other like hotlines and things that if they've, you know, middle of the night and they need to call someone?
Yeah. Don't call me at 2 a.m.
Yeah, I was going to say. So what's the hotline to Sarah?
I don't do on-call work anymore. So look, there absolutely is some amazing support systems out there. And also it depends on where you were giving birth. A lot of hospitals and centres around, and also if you go down a private midwife path, they'll all have their own sort of resources and services. So it's important to know what is available to you for where you are birthing your baby. And also considering booking into a breastfeeding and parenting class when you are pregnant, and making sure your partner attends that with you, because they've found that one of the number one influencing factors on breastfeeding success is partner support. So yeah, it is very, very important for them to attend. Or you can see me antenatally. I do a lot of antenatal consultations with couples in pregnancy, so it sets them up for success.
I was going to say, so do you have sort of like a bit of a program or a meeting that you do with couples so that they can get the foundations and a plan for early parenting?
Yeah. So I do classes out of Restful Waters in Perth. It's a beautiful wellness centre. Otherwise, I do them in their home if they want to do a bit more privately, which a lot of people do at the moment with COVID. Otherwise, the Australian Breastfeeding Association is the most amazing resource. Their website is all evidence-based information. It's the only place you should look, ever. Don't ever Google anything to do with breastfeeding. You'll get some terrible advice and terrible information. So always there. And they've got the 24-hour number as well. So you can get a lactation-trained professional on the end of the phone. Actually, no, they're volunteers, but they are lactation-trained, and they're still quite amazing to have that support and that service there for you.
If you want a lactation consultant, do you only ever seek a lactation consultant after if you're having problems, or can you see a LC beforehand, or how do people find lactation consultants?
Yeah, it's honestly about knowing where to look. There is the Australian Lactation Consultant website where a lot of local to you lactation consultants are listed. So you can often put in your location and then they'll come up. But I do telehealth appointments with women over east. I've come down here and done consults down here and when I'm on holiday. So yeah, it really depends on where you're located as to who and what is around you.
And finding that person that's, suited to you.
Yeah.
You did your consult with me over the phone, and it was good because you have so many visual things that you were able to explain that still gave me a really good understanding of what I had to do. And the hamburger definitely helped me, the idea of that.
I'm hungry.
That makes it's lunchtime. And so where can people find you, Sarah, if they want to seek your help?
My Instagram, I suppose, mindfulmothering_Perth. But like I said, I'm available to anyone and everywhere they are. Otherwise, my website is www.mindfulmothering.com.au. I had to think about that.
We put all of that into the show notes anyway, so people can find you easily, and the other links that you mentioned. Thank you so much, Sarah, for having a chat with me and sharing all of this fabulous knowledge. I think this will be a good one for people who are pregnant to listen to, or maybe in those early days. Listening to a podcast is much easier when you've got your hands full with a little bubba. Thanks, Sarah.
Thank you.